I usually try to lead my videos with education and professionalism, but this is not one of those videos, and I'm going to speak frankly. A big promise was made that by September we would know the cause of autism. Here we are, September, and we have nothing. The reason why is because our current administration is oversimplifying something that is incredibly complex and multifactorial. There is no single answer for autism, and I think it's incredibly ignorant to believe so. And now we're making big claims about Tylenol and autism. But here's the funny part. The person that made that claim yesterday that stood on a podium didn't even bother to learn how to pronounce acetaminophen, and that really just goes to show how seriously he was taking it. Here's the truth. There are no studies showing that Tylenol after vaccines leads to autism. And there are no studies showing that Tylenol taken during pregnancy leads to autism. That direct cause and effect relationship, we don't have data to support that. What we do know is what can happen if fevers are left untreated. For mothers that are pregnant, fevers that are left untreated can lead to premature labor, neural tube defects. For children, that could lead to febrile seizures if left untreated. Now, remember when everyone was concerned about the MMR vaccine and the MMRV vaccine and how it led to febrile seizures? Now imagine taking away the one medication that we have to actually lower that risk for kids under the age of 6 months. It's ironic and it's not protective at all. And as a pediatrician, as a mother, I can tell you, babies under the age of 6 months, Tylenol is the only safe fever reducer that we can use. We use it for pain, for fevers from infection, and yes, after vaccinations, if the child is super pissed off and uncomfortable because he's mounting an immune response. Let's be honest. When leaders go up on a podium and tell women to just tough it out, it's only adding guilt and shame. And trust me when I tell you, I see this every single day. Moms do not need any more mom guilt. They care about their children. They care about the safety during pregnancy. For all my autism families that deal with this day in and day out, for my pregnant moms, soon to be pregnant mothers that may or may not need to take Tylenol, trust yourself, trust the evidence, trust your doctors, trust the science, because this administration doesn't have your back, but science does.